And like I mentioned, please put your name and organization. The chat box will be very important. Now it is my great honor to introduce Lini Jacob, Senior Vice President of 211 Hudson Valley. Lini Jacob was born in India and immigrated to the USA in 1994. Ms. Jacob earned a bachelor's degree in computer science from Lehman College. As Vice President for 211 Hudson Valley Region, Ms. Jacobs brings a wealth of knowledge and experience in the fields of information and referral services and databases. Lini joined 211 in 2004 as a resource manager, and since 2015, she oversees all aspects of United Way's 211 for the Hudson Valley region, a crucial information and referral service which meets New Yorkers wherever and whenever they need it, empowering them to secure a brighter future. So without further ado, I'm going to mute myself and turn it over to Lini for our first presentation. Welcome, Lini.
Thank you, Melissa. Thank you, United Way Dutchess team. Thank you so much for having me here. You just heard, my name is Lini Jacob. I am the Senior VP of 211 Hudson Valley region. I have to say it, I am so excited to be part of today's community united meeting. Yes, we are united to make that change. Before I get into 211, I just want to share how my life is connected with the 211. As Melissa just mentioned, my family migrated from India in late 90s. During that time, I can promise you this, there was no centralized information system in many states, including New York. Like any other Indian parent, I'm sure my parents wanted me to get into medical field, like my siblings, they are, and my extended families, they all into medical field. But I was interested in the computer field, which they agreed. I'm happy for that. I joined United Way right after my graduation. At that time, my goal was, stay with the United Way for 5 years, learn as much as I can, then run with it. I am still here with the 211. This 211 program changed me as a person, how I look at things in life and what appreciate, what I have in life and not complain about what I don't have in life. Because the type of calls we are handling, when we get calls like people looking for food, we get calls about people looking for a place to stay. It changed me. And I will say, sometimes it's very shocking to see, when I run the report, the needs in the community, especially when you get calls from affluent communities, people looking for food. So that is my connection with the 211. So let me get into the 211 world. So what is 211? United Way's 211, it's a helpline which offers health and human services, information, referral, assessment, and crisis support to help callers find services they need. Melissa, I don't see the slide. Do you have the slide?
Yes.
Okay.
We're just going to have actually Emily Darrow click through. So just give us 10 more seconds.
Okay, no problem.
Thank you.
No, as she's going to display that slides, I can talk a little bit more about 211. So 211, we provide health and human service information. It is an easy to remember telephone number. One of the only, it used to be 8 N11 numbers, and now it's a 9 N11 number. 211 is one of the 3-digit number, right? In 2000, FCC designated 211 to improve access to health and human services via information and referral, or you can call it as information and assistance. And we operated by national standard. When I say national standard, this national standard is set by an entity called AIRS. It is an abbreviation of Alliance of Information Referral System. This entity formed in early 90s. They set standards of how to run a call center, how to handle a call, how to maintain the database, how to handle mental health type of calls, how to manage, the resources for a targeted group like seniors, how do you handle calls when you get from veterans. So it's not even just for the 211 world. They set standards for any information and referral field targeted to specific group as well. And in New York State, 211 in New York State is designated based on regional basis. Emily, I believe that is the third slide. No, second slide. Second slide. Okay, I got it. Okay, so 211 New York State is designated based on regional basis. We have in New York State, we have 10 regions and 7 call centers, and it is available across the nation. We are open 24/7. And also, we work very closely with the emergency management so that OEM, emergency management can potentially activate 211 as the point to handle disaster calls. And that's a perfect example, like during this COVID, since March, like when it happened, Dutchess and Rockland, Westchester, Putnam, and a portion of the time for Sullivan County, OEM activated us, our 211 to be the point of entry to offer COVID-related services. So we work very closely with the emergency management. As you can see, 211 is more than just a number. Its essential component includes contact center, the database, searchable website, and also it's include, we can produce data and the report. If you move to the, okay, you have it there. Our 211 Hudson Valley region covers 24 counties. Like I was telling you before, we have 10 regions and 7 call centers. Our call center, one call center handle calls for 4 regions, 7 counties in the Hudson Valley region, 2 counties in Long Island, 12 counties in Capital region, and 3 counties in Adirondack region. So it's outside of Hudson Valley, we handle 17 additional counties, which reaches a total population of 5.2 million people. So you may wonder, who calls 211? Anyone looking for health and human service. That can be different departments in the county, Office for the Emergency Management, Department of Social Services, individual, those are looking for services, and also community-based agencies. If they have a client sitting there, if they need information, they can dial 211, which they've been using it. So what I'm going to do now is I'm going to share my screen to do a live demo on what's happening in the call center now as we speak. So give me a second. Just going to share my screen. Melissa, okay. I'm just going to take that. Okay. Emily or Melissa, can you tell me you can see my call center dashboard? Can you confirm, one of you?
Yes. Yes.
Perfect, perfect. Okay. So what you're seeing on the screen now is our phone system. Okay. Both our phone system and the database, both are integrated. So any information you capture in the phone system, it is automatically captured, transferred to the database. Both are web-based because the database and the phone system, which means staff can work remotely. And this set of us, I will say, super, super helpful during the peak of COVID. And this dashboard displays, you can see it, how many staff logged into the system, what type of contract calls we are handling, how long is the wait time, and what's the service level, or is there any crisis call pending here? So I'm going to spend a little time explaining what it is, what kind of experience, people get when they dial 211. So when a person dials 211, the first message they hear, after the greeting, the language option. We purposely put that option out there because, we don't want to turn anyone away due to their language barrier. We also have bilingual staff. We also have a translation services offer 200 language. Oftentimes we utilize their service as well. After the language option, they're going to hear menu option. It's like a phone branch. Like, if you're calling about basic needs such as food, shelter, press X this option. If you're calling about veteran services, press X option. So there's a multiple options right after the language. Depending on, which language is selected, they going to hear there's one in English and also there's in Spanish. Then they have an option for other languages, right? So what you're looking at right here, I have two staff logged into the system. You can see it's all color coded. You can see what type of contract call they're handling. This list actually tells us the type of calls in queue or, what kind of option the public pressed. So this IVR, this phone system is IVR based, which means it's a skill based. Skill can be a language, skill can be a contract, skill can be a program. So we have a flexibility of setting that up. So if you look at right here, we have, since we manage calls from Northeast, you can see we have 3 calls from Northeast. There's a call from Long Island right now. This is a live dashboard. So this is the information is going to change as we speak. Also, you can see here, so in addition to the 211 core services, we also handle contract-based calls. For example, we have a contract related to veterans, which include support services for veterans who are homeless or who are at risk of homeless. That's for the Hudson Valley region. So 211 is not only an entry point, but the team also takes on the role of case management. We also have a system in place of crisis calls for Putnam crisis contract, like right here. So what's going to happen is, if we get a crisis call, it will jump the queue. When I say jump the queue, it actually, if all staff is handling calls, while they're on a call, they actually get a warning saying there is a crisis call waiting, right? And it's kind of like a marquee. If they don't answer within minute, within 60 seconds, we as a management, we get a notification saying you have a crisis call waiting, no one answered. So there is already a system in place for crisis calls to jump the queue. So the system allows us to prioritize, based on the contract expectation or the type of calls. You can see here service level, like of course in the morning, the wait time is going to be a little longer because you start with the less staff, 8 o'clock. So staff work in a different shift. There's one person at 8 o'clock, then more people joining at 9 o'clock. There's another person at 10 o'clock. So depending on, when you look at the service level, this is going to changes, all the time. So what's going to next, as Jeannie mentioned, 211 is going to play as the entry point of a Dutchess eviction prevention program. So what's going to happen in the phone system for that project is we're going to create a campaign right here, right? That is a skill. Then what's going to happen is that skill is associated to the staff. And when the public, when they press that option, of course, the staff is going to greet the caller accordingly. We may be saying, we don't have the exact verbiage yet, we may be saying, thank you for calling Dutchess County Prevention Program, how may I help you? So we can change the greeting based on, the option the person picked on. So that's specific to that program. So we have the flexibility of changing this piece. So this program should start February 1st. So we're going to work together as a team just to see how we can help the community out. After the public press this option, what's going to happen is staff can greet the caller based on the contract. I will say a typical call, most of the time it's a 5 to 10 minutes. Sometimes it can be 20, 25 minutes, depending on the situation of the caller. We will ask how we can help the caller, then we assess the situation. We also confirm the zip code with, so that we can refer callers to programs and agencies located in their community. So oftentimes when we look at it, the service eligibility varies, right? Sometimes the service offered to specific zip code, or maybe people with a certain income. Also, the intake procedure can be, you need a denial letter from DSS, or you need a referral from a community agency. So we have all those details in the system. So depending on the person's need, the staff read through all the details about that agency. If the referral seems appropriate, we will provide that information to the caller and save the call with the service need, demographic, and other information. The standard for providing services is, we always tell them, please always call us back if the information we provide us, if it is not useful, if it's not helpful, if you need more help, please call us back. We are here 24/7. And I have to say this, many times callers, remain anonymous. They don't want to provide their personal information. I can see from my culture, came from India. My culture is usually, when you go through financial struggle and other struggles in life, you don't want to share with the other people. You don't want anyone to know, I need help with the utility payments. Oftentimes you don't share your information. So that's the same thing when people call 211, they always remain anonymous, but we can always, collect their name, contact information, if the caller permits us to do so, which can be important, if we have a concern about whether the caller can access services without an advocate. We can also schedule follow-ups, with a plan, with a note about purpose of the follow-up, the scheduled date and time. When do we do that? Sometimes when we get calls like from seniors or at-risk people or in crisis, saying, if the senior is saying, my EBT is not working, I'm trying to reach my caseworker, no one is picking my phone. If we sense there is an urgency for it, we always do a conference call with the case manager with the caller's permission and try to see what's happening. So cases like that, if we see that there is a follow-up needed for that crisis or urgent need services, we always schedule follow-up. And I will say this, oftentimes I'll say 99%, when we do a follow-up, people are so happy that, someone is thinking about them, someone, want to make sure that they receive the service what they were looking for. And I will say, sometimes we do get 911 emergency call. If that happens, we are able to call the callers county 911 emergency services from our phone system. I will say this, with our 211, we do have a MOU with all the emergency management, all the 911s. Because of that, we have an access to emergency management, their backup number, so we can dial, and so we have that relationship. And I will say, some of you wonder, Lini, are you able to give information to all calls coming into the center? Honestly, sometimes we don't have information for some of the calls. We call it as a gap in service. For those times when we discover gap in service, We can record that and report back to the community planners and who are making decision as to how to best use resources to meet the needs of the community. For example, why there's a gap in service may not be available because the caller is not eligible for the program, or the caller may say, what, I tried all these XYZ agencies. I don't want to call them anymore. Just give me another agency. Sometimes, the service may be far away. They don't have a transportation available, so they will not be able to get the service what they're looking for. So there's many reasons why there's a gap in service. And, I want to share an example, a true call happened in March. This call, it was from Westchester County. This was a family, mother with the 2 children and husband. They were in a shelter care system, in and out, even before COVID. So because they're in a shelter care system, they need to get out from shelter during daytime. So during COVID in March, the temperature is down, it's cold. The shelter, the management said, you need to leave the building. And so they called us, and having 2 small children, especially with this crisis going on, what we did was we reached out to our local DSS and the health department, shared the situation. And I will say, our DSS was able to expand the shelter services for 24/7 for a period of time. The reason I shared this with you is we as a community, we need to work together to make that change. No, 211 cannot do alone to help a person out. Service providers like you, we need to work together to help individuals out. I know we can. Emily, I'm going to stop sharing my screen so we can go back to the slide, if you don't mind, to make that accessible. Perfect. If you can go to the next slide. Let me see. After that. One more. Yes. Okay. So you can see it from the screen. Regarding the call data, the 211 system is able to generate useful data, including number of calls handled, why they called 211, which zip code they are calling from, do we see a trend in specific need in the community, or if there is an unmet need, we can generate all those reports based on the calls coming into the center, because when the staff talk to the person, they are capturing all this information from the caller. So you can see it in 2020 alone. Last year, we handled over 75,000 calls from the Hudson Valley region. I have to say, that 75,000 we are talking about, if I compare with the 2019, it's doubled. It was more than 50% in last year. Out of that 75, we got almost 10,000 calls from Dutchess County. Let me see. Okay, perfect. So you can see from the slide, can you move the top 5 zip codes? You can see that's a Poughkeepsie, Wappinger Falls, Beacon, Hyde Park. What are the top 10 zip codes we are getting calls from? And I will say, these are clients like Mark, who called 211 because he had thoughts of suicide and didn't know where to turn. Or Joy, who called because her SNAP benefits were deactivated and she didn't know who to call. Or Susan, who is immune compromised and called during the height of pandemic because she was eating her service dog's food to take her medication because she couldn't go out to shop. So you can see, what type of calls we are getting, how we are helping the individuals out. And we are able to help those individuals out because service providers like you are out in the community and providing that direct service. Move to the next slide. Okay, so from this slide, you can see the top service needs from Dutchess County in 2020 alone. So the green one, it's financial. People looking for financial assistance, I can tell you that's more mainly connected with the rent payment assistance. You can see the blue and the pink, which is housing and utility assistance, and also health. Yeah, health also last year was higher. It's mainly because of COVID. You know, when this crisis happened, people were calling 211 about where can I go and get tested, like I have symptoms, so what do I do with it? I'm trying to reach my doctor, he's not returning my call. So there were increase in costs connecting health. So the first is financial, then you can see utility, housing, help, and health go hand in hand. Then also we did see increase in food. People were looking for food assistance. I will say, because of this COVID, some of the food pantries were not able to operate. Sometimes we had only one or two agencies, we can always refer people to. We did see an increase in food. So this chart give you an idea on the type of calls we were handling from Dutchess County. Let's go to the next one. Okay. So, in addition to handling calls, I talked about how we are handling calls, the type of calls coming in, and also what are the needs, information like that. So in order for staff to provide information, we need to have updated resources, right? So updated resources is one of the key element of 211 service. We have over 17,000 programs in the system. One of the national standard, as I mentioned earlier, is we supposed to update all information once a year. As you could imagine, during this COVID time, the information was changing rapidly. I think we were in contact with the agencies multiple times. And what I want to share with you is how people can reach 211. There's three ways they can reach us. A, they can dial 211. You as a service provider, one thing I want to point is sometimes in business, like as an organization, the phone is not set up to dial 211. I meant the N11 number. So because of that, we also have a 800 toll-free number, which is 800-899-1479. We can actually put it in the chat so you can see it. So the easy way is by dialing 211, but the phone setup can also change to allow the N11 dialing, which is 211. That's one way to reach us. The second way is you can also reach us by texting. If you text your zip code to 898-211, you're going to reach us. So this is a 898-211 is a national texting code for 211. So the zip code you're putting, if it's a 10705, the system is going to recognize which region it linked to, then we going to get that text. So people can also reach us by texting, which is 898-211. You can also search our website. Our website is 211hudsonvalley.org. Emily, can you move to the next? So there's multiple ways, you can reach us. We are available 24/7 by dialing 211. You can reach us by text. That also, the texting is limited hours. That's a Monday through Friday, but you can always call us, which is 24/7. So our website is displayed here. You can see it. That's at 211hudsonvalley.org. Move to the next one, Emily. Okay, you can also contact us as a service provider, just to make sure whether your information is listed in our 211 system. You can click on it. There's information right there. You can email. You can also, reach me directly if you want to make sure that your information is listed in the database, and also make sure that, we have up-to-date information. So, my ask is, like, as a service provider, please, use 211. If you're looking information for your clients, you can reach us by dialing 211. And lastly, we want your help. You can help us by making sure your information is listed in the 211 database is up to date. I'm going to stop here unless anyone has any questions. I want to say this: if you'd like to know more about 211, please don't hesitate to contact me directly, or you can dial 211.
Thank you,
Melissa,
Lini. Yes, we do actually have a few questions.
go for it.
Yeah, so one was, does 211 utilize volunteers?
We use volunteers for disaster time, to manage costs. For our regular operation, we have paid staff. We don't use volunteers.
Thank you. Great. And one agency was wondering, they help with a lot of mental health crisis. If there's any way that they could collaborate around those that call them in mental health crisis.
That's a great question, great information as well. Absolutely. We definitely can take a look into it and see, whether we have even all mental health service information in the system as well. Definitely we can collaborate. And this way we can make it easier for the public, the individuals, those are looking for information. We can, it's just that one number they can call and get information.
Great. Yes. And another organization was asking how they submit their updates to you.
You can contact us via email. That was info@211. I'll tell you right now. If you can put it on the chat box, Melissa. It's a 211 info@hudson211.org. That is 211 info@hudson211.org.
Excellent. I will put that in momentarily. We also had a question, are there other websites for other regions of New York State outside of the Hudson Valley?
The easiest way is you can go to 211newyorkstate.org. It actually lists all regions in New York State. From that homepage, you can click on by county or even by region.
Great. Is there a way for organizations to add your organization to their websites?
Oh, I would love to. Absolutely, absolutely. We can send a logo, and maybe you're talking about adding the information on their website, correct?
Yeah, so folks can know about 211 that go on their website.
Yes, we can give a logo, clickable logo, and it will take, users to our website, or, vice versa.
Great. And that's all I had for the moment. Does anyone have more questions for Lini? It's such an informative presentation. And I know most of you hopefully know about 211, but if you don't, that's okay. Now is the time to learn. So does anyone have any questions? I don't think we got a chance to cover it, but it is a 24/7, 365. So, always very important. One person asked who to contact about that logo. So maybe Lini, you could put your email in the chat box.
Absolutely, I will do that.
Somebody else asked if the logo would work on a Facebook page.
Yes, we can. Yeah.
Excellent, excellent. And I'm going to put that email in just a second as well that I spoke about. Does anyone else have any questions for Lini? We have some comments on just how great this resource is to spread the word in the community. And did the question about how to update agency info get answered? Yes, so you're going to be able to send your information, your updates on different initiatives and things like that to 211info@hudson211.org, which I'm going to put in the chat box in just a second. But I just wanted to, before I do that, I just wanted to see if there were more questions for Lini while we have her attention. Yes, Linda Eddy says that 211 has a great team. Absolutely, can't say that enough.
Thank you, Linda.
Anyone new to 211 and would like some more information? Now is your time to ask. Okay, great. Lini, I'll turn it back to you.
Am I on mute now? Okay. Melissa, okay. This is it from the 211 end. I just want to say thank you for listening. And, you know, all I just want to say at this point is please make sure your information is up to date with our system, because, you know, we always want to make sure that we are providing, you know, right information to the callers. And that way, you know, we are also putting correct information of your agency with the callers. Thank you all.
Lini, thank you so much. That was so informative. And it's such a great resource. Yep, people are applauding. Yay.
Thank you.
But we have a great partnership with Lini and her team. So I can't thank you enough.
Thank you so much, Lini. That was incredible as always. You're such a wealth of information. We're so appreciative. I always learn so much hearing from you, and it was really great to see the dashboard and really see the inner workings of how it all happens. And for those of you that don't know, you can call 211 for just about anything. And, you know, hearing some of those examples, especially during the pandemic, was really moving. So thank you, Lini, so much for your time with us. We're actually running a few minutes ahead of schedule. So instead of a 2-minute break, I'm going to give you a 10-minute break. So feel free to refresh your coffee or tea and get ready to learn. We have another dynamic presentation coming up in 10 minutes. Thank you.